Hello there, my name is Dr. Rajiv. Welcome to my education channel YouTube Surgery and Orthopedic Education. Today we shall discuss the spine and spinal cord anatomy. In the end, please subscribe to our channel and give us a like if you find the lesson useful. The vertebral column is a biomechanical, dynamic and axial structure with many motion segments. Each motion segment comprises two adjacent vertebrae separated by an intervertebral disc and stabilized by ligamentous restraints. Within the vertebral column lies the spinal cord, a part of the central nervous system, and extends downward from the brainstem up to the lower back. Because the spinal cord is much shorter than the length of the vertebral column, the spinal segments do not lie just opposite the corresponding vertebrae. The spinal cord carries sensory signals from different parts of the body to the brain and sends commands from the brain to the other parts of the body. It is also the main processing unit for reflex actions. Gross anatomy of the spinal cord. The spinal cord occupies upper two-thirds of the vertebral canal and is surrounded by three meninges. 31 pairs of spinal nerves originate from the spinal cord. The length of the spinal cord is 45 cm in an adult male and 42 cm in an adult female. The weight of the spinal cord is 30 grams. It extends from the foramen magnum, that is from the upper border of the atlas vertebra, to the lower border of the first lumbar vertebra in adults, whereas in children it extends up to the L3 vertebra. The end point of the spinal cord is called conus medullaris. Below this level, it continues as the cauda equina. It is important to remember that spinal segments always lie lower than the vertebral segments. The spinal cord is surrounded by three meninges. From outside inward, these are dura mater, arachnoid mater, and the pia mater. In the lower part, below the first lumbar vertebra, the spinal cord extends as conus medullaris. Below the conus medullaris, only the pia mater continues as a 20 cm long, thin fibrous cord known as filum terminale. The subarachnoid space containing CSF extends up to the second sacral vertebra. The dorsal and the ventral nerve roots of the right and the left sides of the second lumbar to the first coccygeal spinal segments lie vertically around filum terminale, and these are called cauda equina. There are 40 nerve roots at the beginning of the cauda equina. The spine is made of many parts that protect the spinal cord, facilitate movement and support the body. The vertebral body forms the anterior part of each vertebra. It is the weight-bearing part of the spine. The vertebral arch forms the lateral and posterior aspect of each vertebra. The vertebral canal is formed by the lamina and the vertebral body. The spinal cord sits in this space. The spinous process is a bony projection from the back of each vertebra. Each vertebra has a single spinous process. The transverse processes are bony projections that extend laterally and posteriorly from the vertebral body. Each vertebra has two transverse processes. Pedicles are the bony processes that connect the vertebral body to the transverse processes. Lamina are the bony processes that connect the transverse and spinous processes. The intervertebral discs separate the vertebrae. Classification of spine trauma. The Magnum and AO spine thoracolumbar and subaxial classification systems are currently used for spine trauma classification. It is based on the mechanism of injury and is used to assess the spinal stability after trauma. The spine has been divided into three columns: anterior column, middle column, and posterior column. The anterior column is formed by the vertebral bodies and discs, and the middle and the posterior columns by posterior joints. If two or more columns are injured, the spine is considered unstable. The spine's stability maintains its structure and anatomical relationship during normal physiological loading. The spinal stability allows the spine to bear loads, allow movements, preventing injury, deformity, pain, or neurological deficit. There are 7 cervical vertebrae. The third, fourth, fifth, and the sixth are typical, while the first, second, and the seventh are atypical. The identifying feature of the cervical vertebrae is the presence of foramina transversaria in each cervical vertebra. There are 3 primary and 6 secondary centers of ossification in each typical cervical vertebra. The two halves of the neural arch fuse posteriorly with each other during the first year, and the synostosis at the neurocentral synchondrosis occurs during the third year of life. The secondary centers fuse with the rest of the vertebrae by 25 years. The first cervical vertebra is called the atlas. The atlas ossifies from 3 ossification centers. These appear during the 7th week of intrauterine life and unite posteriorly at about 3 years of life. The second cervical vertebra is called the axis. The axis vertebra is identified by the presence of the dens or odontoid process projecting upward from the body. The seventh cervical vertebra is called the vertebra prominens because of its long spinous process, the tip of which can be felt through the skin at the lower part of the neck. Its ossification process is similar to that of a typical cervical vertebra. The seventh cervical vertebra may get enlarged to form a cervical rib, which is an additional rib arising from the seventh vertebra and usually gets attached to the first rib. The cervical rib may be more than 5 centimeters long. It usually displaces the brachial plexus and the subclavian artery upwards. The intervertebral foramina of the cervical vertebrae lie anterior to the facet joints. Osteophytes around the facet joints may press on the cervical spinal nerves in the intervertebral foramina, causing pain along the course and distribution of these nerves. Lasca joints are the small synovial joints situated between the 5 lower cervical vertebral bodies. The cervical nerve roots lie posterolateral, and the vertebral artery passing through the foramen transversarium lies anterolateral to these joints. The osteophytes of the Lasca joints may press on these structures and cause nerve root pain and compression of the vertebral artery, leading to vertebrobasilar insufficiency. The intervertebral disc prolapse in the cervical region commonly occurs around the sixth cervical vertebra. This causes pain and numbness along the lateral side of the forearm and in severe cases wasting of the muscles of the thinner eminence. In judicial hanging, the odontoid process usually breaks and crushes the vital centers in the medulla oblongata, leading to instantaneous death. There are 12 thoracic vertebrae. The second to eighth are typical, while the first, ninth, 10th, 11th, and the 12th are atypical. The presence of costal facets on the sides of the vertebral bodies is the identifying feature of the thoracic vertebra. There are 6 facets per thoracic vertebrae, 2 on the transverse processes and 4 are demifacets. Demifacets are the facets of the transverse processes which articulate with a rib. The body of a typical thoracic vertebra is heart-shaped. Thoracic vertebrae ossify in cartilage from 3 primary and 5 secondary centers. At birth, the thoracic vertebra consists of 3 parts. Bony fusion occurs during the 3rd to 6th years of life. Failure of fusion of the two halves of the neural arch results in a spina bifida. The most common location of the spina bifida is the lumbar region, followed by sacral, thoracic, and cervical regions. Lumbar vertebra. There are 5 lumbar vertebrae. The first 4 are typical and the 5th is atypical. Large size, absence of costal facets on the body, and the absence of foramen in the transverse process are the identifying features of the lumbar vertebra. The body of the fifth lumbar vertebrae is the largest of all lumbar vertebrae, and its spine is small, short, and rounded at the tip. A lumbar vertebra occupies from 3 primary and 7 secondary centers. The lumbar region is the common site of a number of developmental and degenerative disorders ranging from backache to spina bifida. The failure of fusion of the two halves of the neural arch, leaving a gap in the midline, results in spina bifida developmental anomaly. The lumbar region is its commonest location, followed by sacral, thoracic, and cervical regions. Sometimes the major part of the fifth lumbar vertebra slips forwards over the sacrum, leading to a condition called spondylolisthesis. Fracture dislocation of lumbar vertebrae results in the cauda equina syndrome. After the second decade of life, degenerative changes may set in, resulting in softening and weakness of the annulus fibrosus, as well as necrosis, sequestration, and fragmentation of the nucleus pulposus. After minor strains, such a deformed or fragmented disc is liable to displacement, resulting in prolapse and pressure upon the adjacent nerve roots and giving rise to referred pain such as sciatica. The disc prolapse is usually posterolateral and occurs most commonly in lower lumbar region between L4-5 and L5-S1 vertebra. It is also common in lower cervical region from the 5th to the 7th cervical vertebrae. Sacrum or vertebra magnum and coccyx or tailbone. The sacrum or vertebra magnum is a large, flat and triangular bone formed by the fusion of 5 sacral vertebrae. It articulates with 5th lumbar vertebra. Its projected anterior margin is called the sacral promontory. Its surface is curved forward at an angle of 30 degrees. Inferiorly, the sacrum articulates with the coccyx. Within the sacrum lies the triangular sacral canal, which is a continuation of the lumbar vertebral canal. The sacral canal terminates inferiorly as the sacral hiatus. The sacral canal contains sacral and coccygeal nerve roots, dura and arachnoid meninges up to S2 level and phylum terminale. The spinal epidural space extends to the sacral hiatus. The coccyx or tailbone is a triangular bone formed by the fusion of 4 rudimentary coccygeal vertebrae. It is the last segment of the vertebral column and is a vestigial tail-like structure.